founder of Cooking Champions. For those of you who haven't heard of us, we started 2 years ago at the start of COVID. My background was being a secondary maths teacher and owning a catering business. I lost my catering business due to COVID. I was like, right, I can either sit in my house, get upset, or I can put my skills to good use. So I had, through some contacts, a pallet of food arriving. I sent one message out on social media saying, can anyone help? Within 24 hours we'd made over 400 meals and distributed them.
Oh my gosh.
And then within 10 days we were making over 1,000 meals a week, and then that continued right through to the summer holidays. So we were providing a lot of meals for families that couldn't afford otherwise. We also help victims of domestic violence, people with mental and physical health issues, refugees. We just like to think we're there for anyone that needs support. Where we're at the moment, we've now made 50,000 meals, mainly from redistributed food from the Felix Project and donations from the public. And we still deliver food packages to about 200 people across the borough every single week, and that's been going since April 2020. We haven't missed 1 week, which we're very proud of. And then we are launching something really exciting where I'll save that little gem to the end of the presentation. So thank you for inviting me. I am nowhere near an expert in any of this. I'm just kind of sharing my thoughts with you and my experience of the local community that we work in, and it's more of a learning experience for me to hear your ideas and suggestions, and hopefully partnerships will come from this meeting. So I'm ready to learn and to listen as well. So, as I'm sure it's been discussed already, why do we need to change our planet? So I was just doing some research and the statistics are incredible in a bad way. So sorry if I'm reading from my phone, I thought there was going to be a presentation, so bear with me.
Don't worry.
1 in 5 deaths globally is due to a poor diet. 2 billion adults are overweight or obese, but 500 million are underweight. Let us just sink in for a little bit. And then in terms of the effects on the planet, the food we eat is responsible for between 1/4 to 1/3 of all greenhouse gases, 70% of freshwater use, and about 40% of land use, and those sources are from the British Nutrition Organisation. So, most of you in this room are passionate about making a change and making an impact, and the messages are quite clear, they're quite consistent. What do we need to have a healthier diet? And some of the key ideas that come up in research, in the media: grow your own food, which we've been talking about with the allotments, buying seasonal and organic veg, eat less meat, avoid highly and ultra processed food, and eat more plants. None of this is groundbreaking, and I'm sure most of you in the room know a lot more than I do. The reason why I'm here today is kind of to express my experience of, we know what we should be doing, but then you have the reality of people's lives, and I think that goes back to your point, and they're not matching at the moment, so it's with your help, how do we bridge that gap? So, the majority of people that we help in the borough are on the east side of the A10, where the highest levels of deprivation are. I would say 85% of the families we help are on the east side of the borough, and people are struggling. People have struggled. COVID hit and that made things really, really difficult, but now people haven't even recovered from financial, emotional, just lots of life circumstances, and then they're hit by the cost of living crisis, which is having a horrendous impact on people's lives. Unfortunately, for the last 3 weeks in a row, we've had a record-breaking number of referrals. Now, we were expecting a spike in October, and we're only on the 5th of October. We are absolutely dreading what's going to come. We're working our hardest to provide for everyone, but with your help, hopefully, we can have a stronger impact across the community. So, the issue, the financial cost of a healthy diet. So we work a lot with the Food Foundation. Here are just some key facts to think about. The poorest fifth of UK households would need to spend 47% of their disposable income on food to meet the cost of government recommended healthy diet. This compares to just 11% for the richest fifth. So like what you were saying, if you haven't got any money, most people would aspire to have a healthy lifestyle, but if you've got £2 to feed not only you but your family as well, what are you going to pick? It's likely to be processed, cheap, available food which might not be as nutritious. So, more sustainable plant-based alternatives are approximately 60% more expensive than dairy items as well.
No, but not if you cook lentils. It's only if you buy processed food, isn't it?
So I'll come on to that point. So you raised a good point, but I'll address that slightly later on as well. So what's the solution? Is ensuring everyone has sufficient income to afford to eat a healthy diet. And again, when you said your thing, I was like, it just ticks every box. It's all well and good knowing what to eat, but then if everyone hasn't got the income to buy those goods, it's not a straightforward answer. So I don't like to dwell on problems. I always try and look for solutions. The Felix project has been amazing for us. We're using food that would have gone to landfill and using it in a really productive way. And I'm sure there's other organisations that know how much we benefit from the Felix project or other organisations. And then the second issue, accessibility. So this is only based on our experience, so other people might have different experiences. Lots of the people we help are unable to go to large supermarkets due to lack of transport. So people tend to be more reliant on local, smaller shops. The items are generally more expensive and have less fresh options compared to larger supermarkets. And looking at sort of the makeup of town centres, the least deprived fifth of local authorities have 22% of places that are defined as fast food outlets, with the most deprived fifth of local authorities has 31% of outlets defined as fast food outlets. So a higher concentration of fast food outlets in deprived areas. And then the third issue, it costs money to be economical. Now there's a fantastic article on this by a local councillor in Cornwall, and I said I'd happily share it with you. He's talking about that you need money to be economical, and he writes beautifully, you have to read it, about batch cooking. So often it's a phrase thrown about, oh, if you just batch cook, just eat porridge, you can do this, you can do that. It's not as easy as that. So he just used the example of cooking soup, just plain old soup, nutritious, easy to make, or is it? So he was saying, being able to batch cook soup, first of all you have to have access to cheaper food, which goes back to the supermarket example. It relies on having your own kitchen. A lot of people that we help are in hostels or emergency accommodation. They're sometimes in a room with just a kettle and, if they're lucky, a microwave. Having a well-equipped kitchen, we have recipients where they have to live in shared accommodation where their food gets stolen from other people living in their house. Now, luckily, that's not an issue I've had to come across personally, and it might not be on people's radars, but that is an issue. Being physically able to cook, again, we help a lot of people with physical disabilities, the elderly. They can't, it takes a lot of effort, even for me, if I've been chopping pumpkins at the moment, it's hard work. So if I'd like to think I'm relatively fit and healthy, and I'm like, whew, that was a bit of a workout, how are other people supposed to do that as well? Having a freezer, being able to afford to run a freezer at the moment, so once you've batch cooked it, you have to keep it somewhere, and then having the money to afford energy costs. And this is the point I wanted to raise, not necessarily lentils, but in terms of, we've been giving food out for 2 years now, and only recently we're starting to have people giving us food back. And it's not because they're ungrateful, it's because they can't afford to cook it. So things like root vegetables or anything that needs to be roasted, they're just like, we can't afford to have our ovens on that long. which is shocking. So they want support, they want to cook for their families, and they've been given the food, but it's that financial problem that is just causing them so much stress. So based on our experience, and it could be different from everyone else's, having that facility to cook was the missing link. So we're very pleased to announce that we've launched the first community kitchen in the borough, just round the corner in South Street. It's a dedicated community kitchen. We've done lots of cooking in the community already, but we've always had to lug the chairs out and everything else, and it's very stressful because you generally have to do it in a really short period of time, or it costs a lot of money to rent out a commercial space. But this is ours, and when I say ours, I mean everybody in the communities. We will be running it, but we want to rent it out to other people, to other community groups. Our point of view is, or sort of the way we think about it is, the more people that can benefit from our kitchen, the better. We're not precious about it, we want to share it with the community. It's a safe, warm space to be used for food support, education and training. And the first project that we're launching on, just because we believe this is the most urgent, is our open kitchen sessions. So starting this Friday, which we're very excited about, between 10 and 1 p.m, we have 8 beautiful tables set up like your Master Chef or your Bake Off. Yeah, we're going high class with this one. People come in, they register. That information is just for us so we can track what impact we're having. We will provide all the fresh food, all the fresh vegetables, meat, fish, lots of cultural ingredients as well that we've invested a lot of money in, which are quite hard to get in some food banks. And then, I think this is the key bit, we're letting people have 2.5 hours cooking time in our kitchen. So they can either have help from myself and one of our other chefs, Ela, or if they just know they want to cook for their family, they know what they want to cook and they're just going to get some meals done in those 2.5 hours, they can cook what they want. And I think this is really important because as many meals as we've cooked, I'm not an expert in every cuisine, far from it, as neither is our other chef. How can we expect to cook families' favourite meals or meals from their culture that taste just like their mum used to make or from their background? The idea is it gives people that independence and that pride. I think we often find people are very, very hesitant to get help from us, and this is just another way, based on our experience, we've tried to tailor our services to break down those barriers. So then they take it home in Tupperware, they can eat throughout the week, and then they can come out and do it all again the week after, and that's completely free. We don't know how popular it's going to be. Hopefully it's going to really take off, and if it is, we've got the staff, we've got the facilities, we've got the food. We'll just open more and more of those workshops up, and then hopefully as we can demonstrate the impact we're having, that's going to help with finances as well. So yeah, that's what we're really excited about. And then we've got lots of things coming up, parent and children cooking lessons, helping people deal with different dietary changes. So for example, if they've just been diagnosed with diabetes, cancer, that has a huge impact on your diet. So that's kind of what we do in a snapshot.